Listening to that is Health Minister David Clark. He's described the inquiry's recommendations as a once-in-a-generation opportunity to make real change, and he joins us now live from our parliamentary studio. Good evening, Minister. What assurances can you give people like Natasha Sadler that you will do everything in your power to make these recommendations a reality?
Good evening, Lisa. We have committed already to our next budget having as one of the key priority areas mental health and wellness. This government has already invested in its first budget earlier this year 200 million more into DHBs for responses. We've started a number of new programs, the Mana Ake program. We've rolled out further nurses in schools and so on. Just to illustrate, a number of steps have been taken, the most recent of which is the community services card rollout, which will mean 540,000 more New Zealanders
But what about
will get
these new
access
recommendations?
to affordable GP visits. Well, absolutely, Lisa. We're now working through those carefully but urgently because we want to make sure that we are lined up for the next budget round to make sure that we are responding to the report. It was deliberately kept as a shorter time frame for the report so that we would be able to work through carefully, but in time for the next budget, an appropriate response.
Because this report is actually asking you to make a funding proposal for next year's budget. Will you be able to do that?
I certainly will be pulling together funding proposals as a result of the report and in reference to the report. That was part of the way it was set up in our first 100 days. Some people called for a report that would have taken some years to complete. We weren't comfortable with that. We wanted to get the sector united and those who have grieved united in a response. I think that that's been achieved through the significant submissions and the way that that panel's worked very hard to pull together the voices that they've heard.
All right, the current target is 3% of the population having access to specialist mental health services. The report says it should be 20%. That is a massive increase. So what does that mean in terms of funding? Does it mean significantly more funding or just shifting resources around?
Well, look, I'm not able to make the considered response of the government today, but that's one of the significant recommendations in the report. It's true that this has been something that we've been hearing about, so some of the things we're doing already in terms of having a talking therapies pilot up and running this year are aimed at looking at ways in which we can start to make that care more accessible to people in primary health care settings in their communities, essentially, at the mild to moderate end. And that's one of the things that comes out really clearly in the report, that we need to look more broadly, not just at those who are at the hard end in really desperate situations, but those who are already presenting with concerns early on.
In 2015, 505 people died by suicide. A recommendation as the report is to reduce our number of suicides by 20% by 2030. Is that ambitious enough?
Well, I'm uncomfortable, I have to say. I'm on record already saying I'm uncomfortable saying any level of suicide is acceptable from my view. We'll look carefully at the report as a Cabinet. My Cabinet colleagues have not long received it and work through what our response is to each of the recommendations.
Do you commit to making a target, a reduction target though? Do you commit to making a reduction target?
I'm not committing today to a government response. We want to work through carefully. We want to recognise.
Why is
well, we
that?
want to do justice to the
Minister,
voices we've heard, Lisa.
Yeah. I just want to finish by saying you, during a debate in the lead up to the election on mental health issues, said that if you were in government, you would commit to an actual target. So here's your chance. Are you going to make that commitment?
Well, today I'm not going to commit the Cabinet to anything until we've had a chance to look at in detail at the findings. What I don't want to do particularly is commit us to anything without a plan as to how we're going to deliver on it. That would be empty rhetoric. It'd make great headlines, but we're actually concerned to make sure that we can deliver on the substance of this report. It is a really important report.
And I suppose the number would be the substance. I'm asking you if you agree in principle and would commit to making a reduction target.
As I've said in all media today, we are treating this with urgency, but we're working through the recommendations carefully so that we've actually got the methodology that we can back up anything we say we're going to do. We want to make sure that we're resourcing things appropriately, that we've got the systems in place for any responses that Cabinet agrees to.
Drugs and alcohol, we're still taking a punitive approach to their use, and this report recommends that personal use we should take a civil approach, recommend treatment or issue fines. That sounds sensible, doesn't it?
One of the things that's in the report that's really clear, I mean, we've been hearing this from academics. This report brings the voice of the people to the fore and says those who are wrestling with addictions and mental health issues want a different approach to drugs as well. So we'll pick carefully through that, make sure that we are responding in a way that is adequate. But what's clear, I think, from the synthetics issue, and that was raised in the piece that played before I came into the interview, Lisa, is that as we've picked our way through that issue, the existing legislation makes it very difficult to distinguish between users and dealers, and that's an issue we're going to have to look at more closely.
And that's the interesting thing, because decriminalisation will require legislation. So how confident are you that you can get other parties on board, because you need them for this?
Well, what I have to say, across the coalition there has been really constructive conversations in the initial conversations around the way we treat drugs. Everybody, especially as we've wrestled with the synthetic issue, has been at the table saying we want to make sure this is treated as a health issue, because we can see that users and other vulnerable people are in a position, often not of their own making, or if it was of their own making, from which they can no longer extract themselves. We've got to make a priority in providing the addiction services for people who come forward, but we also need to look at how we're set up now, because it's very difficult to make minor amendments to our current law that makes sense.
Yeah, but your coalition partners didn't sound too positive today about changing alcohol laws, and that is another area that has been singled out, saying that basically we're selling alcohol too cheaply, and past recommendations, including increasing the drinking age and increasing tax, have been ignored. Are you going to push ahead with those changes?
Again, I'm not announcing the government's response today, but we'll take those recommendations seriously. There are a number of recommendations on drugs and very specific ones around alcohol as well. We'll pick our way through those and make sure that any response we have is backed up by a plan of action that will actually deliver on.
The report says that there are groups with strong vested interests in stopping that happening. Do you think you are, well, brave and bold enough to stand up to those groups with a vested interest?
This government has been really clear. I mean, this is part of our 100-day plan launching this inquiry. We are committed to mental health and addiction and to significant change happening across our mental health and addiction sector, and so the public will be expecting to see change. We're not going to rush into it today. It's not going to be that we're announcing everything today, but I think this report and the work that's represented in it, when people get the chance to see it, will be regarded as significant, and a significant response will be expected from us.
Minister, just while we've got you here, Hill Morton Hospital, what is going on there? A number of serious, very serious assaults in recent days.
Yeah, I'm very concerned. I've been advised of these assaults. I understand that the DHB is meeting with the authorities around workplace safety. I think every nurse is no different from any other workplace. Every nurse should be expected to be safe in their workplace, and I'm deeply concerned by what I'm hearing.
Thank you for joining us this evening. That is Health Minister David Clark.